This evening, Arkansas has reached a sobering milestone in the fight against COVID-19. Now, over 9,000 Arkansans have unfortunately died from the virus. About 900 new cases are being reported tonight. Active cases up 391, bringing our total to 7,962. 10 new deaths, bringing our state's total to 9,007 for the entirety of the pandemic. 85% of those deaths have happened in unvaccinated people. Our case numbers are still nowhere near as high as we saw in the summertime surge, but it's unclear how many cases are going unreported because so many people are using at-home testing kits now. Well, if you're rushing to get tested ahead of the Christmas this weekend, you are not alone. THV11's Jay Jackson shows us how pharmacies, clinics, and hospitals have seen an uptick in COVID-19 testing because of the Omicron variant.
A familiar sight for the last two holidays.
There's lots of questions about the Omicron variant.
People getting tested for COVID-19 ahead of traveling and gathering with family and loved ones.
The numbers from CDC earlier this week indicate that in a number of states, it's the majority of cases. I expect we have a lot of Omicron in Arkansas, but the problem is that doing the genetic testing on the virus to tell that takes time.
Dr. Robert Hopkins with UAMS says overall testing rates have been up and down. There haven't been as many people coming for testing as he had hoped.
You know, we're seeing some people coming in for testing when they're coming into town to be with families.
But he believes at-home testing may be the reason.
Starting off the week, we had probably about 6 or 7, and then we started getting calls on Monday and realized very quickly that people were going to be wanting them for the holidays.
Over at Kavanaugh Pharmacy, they've had the at-home test for about a month.
And we've sold 40 or 50 tests in the last 24 hours.
Now they're sold out, reserving kits on first-come, first-served basis. Their wholesaler is out too. Although doing the kits at home can be convenient, Pace says sometimes it's not as accurate as going through a drive-through or a clinic.
I think the main issue with the at-home COVID tests are people have to be willing to swab themselves appropriately. And so when we do our testing here, we're making sure that we get all the way up in the person's nasal cavity to make sure that we're getting far enough back where the virus can live.
In Little Rock, Jay Jackson, THV 11 News.
Thanks so much, Jade. Yesterday, the Biden administration promised to ship more than 500 million at-home COVID tests nationwide for free for any household that requests them. That program isn't up and running just yet.